Recovering from a total hip or knee replacement comes with its own unique set of challenges, and having the right tools on hand can make all the difference. Today, we're diving into some must-haves for a smooth and successful recovery journey. These aren't just nice-to-haves, they're recovery game changers. And if you've got a favorite tool or tip that worked wonders for you, be sure to share it in the comments below. I'm Dr. Tyler Goldberg, an orthopedic surgeon and founder of TDG Concierge Services. With over 12,000 joint replacement surgeries and 25 years of experience, I've helped literally thousands of patients prepare for a successful recovery. If you're preparing for surgery or helping a loved one recover, hit like and subscribe. You won't want to miss the videos we have coming up on recovery, mindset, and modern joint care. Today, I'll walk you through exactly what you need and what you don't. Ready? Let's hit it. Number 1, walker and a cane. I recommend a 2-wheeled walker right after surgery. It gives you mobility and stability as you regain confidence in your movements. The 2-wheeled walker design offers better maneuverability than 4-wheeled models while still providing excellent support when you're feeling uncertain on your feet. Most patients find this assistive device invaluable, especially during the initial recovery phase, as it helps prevent falls and reduces strain on your healing joint. You'll later transition to a cane, which helps bridge the gap as you gradually strengthen your muscles and improve your balance. This progression from walker to a cane is an important milestone in your recovery journey. It signals increased independence and improved function. Number 2, pain medication. Pain is absolutely expected after a hip or knee replacement, but the goal isn't zero pain, it's controlled pain. Enough relief so you can sleep, move, and participate in your physical therapy. Traditionally, opioids like oxycodone or hydrocodone are prescribed after surgery, and they do have a place in the early stages of recovery. However, we want to use the lowest effective dose and shortest possible time of that medication because it has side effects such as constipation, nausea, dizziness, and in some cases, even dependence. That's why we often use a multimodal pain program management approach. This might include Tylenol or acetaminophen for baseline pain control. Anti-inflammatories like ibuprofen or celecoxib or meloxicam also work as long as they're safe for your kidneys and stomach. Ice therapy reduces swelling and inflammation, and nerve blocks or local nerve anesthetics often are placed during your time in and around surgery. Topical creams and gels for localized pain relief are also used quite liberally around surgery. We're also seeing more interest in non-opioid alternatives such as CBD or cannabidiol. CBD is a product of the hemp plant, which also produces THC. However, CBD helps to reduce pain, inflammation, and anxiety, all without those mind-altering effects of THC. It's important to check with your surgeon or care team before using it, especially since some products can interact with medications or be inconsistent quality. Other non-pharmacologic strategies include meditation, breathing techniques, guided imagery, and physical therapy itself, which can improve pain through movement and circulation. Bottom line, the best pain plan is one that minimizes opioids and maximizes function and is tailored to your body. Let your care team know how you're feeling, and don't be afraid to speak up if your pain isn't under control or if you're having side effects. Number 3, blood clot prevention, medication, and other adjunctive devices. One of the most important things we focus on after hip or knee replacement surgery is preventing blood clots, particularly in the legs. We call these deep vein thrombosis or DVT. We also are trying to prevent lung clots such as pulmonary embolism. After surgery, your circulation slows down due to decreased movement, and that increases the risk for clot formation. To lower that risk, we usually prescribe blood clot prevention medication. This might include aspirin, which is often enough for healthy patients at low risk for blood clots. Stronger blood thinners like enoxaparin, apixaban are especially used for high-risk individuals. But medication is just one part of the equation. We also use mechanical methods to keep your blood flowing. These include TED stockings, which are tight-fitting compression stockings that help improve the circulation in your lower legs. They also will take away the swelling. They squeeze the legs, reducing blood pooling and lowering your clot risk. You may be asked to wear them for a week or even several weeks after surgery. We also use leg compression pumps, or SCDs. In the hospital, we often use what we call sequential compression devices that wrap completely around the lower leg and will rhythmically inflate and deflate, stimulating contraction of the muscles. While these will help prevent blood from sitting in the stagnant veins, they are often used only temporarily. We do have home use for those as well. And of course, movement is perhaps the best medicine. Getting out of bed, doing your ankle pump exercises, and walking with your walker are all critical movements that will help reduce your risk of blood clot. They help your muscles working again, and they encourage healthy blood flow. The combination of medication, compression, and early movement is the best way to protect against dangerous blood clots after surgery. Number 4, ice. Pain and swelling are natural, expected parts of postoperative recovery. However, effective ice therapy proves absolutely essential for optimal healing. A specialized dedicated ice machine systematically circulates cold water through the affected joint, significantly reducing inflammation, minimizing pain, and providing consistent temperature control. This targeted cooling approach not only alleviates pain, but also helps decrease swelling. It accelerates recovery time, and it substantially improves overall patient comfort during the critical healing period. Number 5, a comfortable chair or even recliner. A supportive chair that allows you to elevate your leg and sit comfortably is crucial. Look for something that's firm enough to get in and out of easily, and avoid anything too low or soft that makes you stand and struggle. Number 6, transportation help. Driving really isn't an option right away after your procedure. It's essential to make proper arrangements for someone reliable to transport you to and from your appointments or your physical therapy sessions. These appointments are crucial for your monitoring and your healing and progress in ensuring optimal recovery outcomes. Recovery is truly a team effort, and that requires coordination between you, your caregivers, your healthcare providers, and your support network. Having a transportation secured in advance will significantly reduce stress during your healing journey. Number 7, patience. Patience with your recovery process. There will be good days and there will be tough days. Swelling might return, maybe a pain flare or two. Progress might feel very slow. That's all completely normal. Being mentally prepared for ups and downs helps you stay the course without getting discouraged. Number 8, organization. Recovery takes a lot of moving parts. Medications, supplements, physical therapy, follow-up visits. Having a calendar, pill organizer, or app that can help you stay on track and avoid missing anything important can be crucial during this perioperative period. Number 9, a support system. Recovery isn't just physical. The emotional and psychological aspects of healing are equally important and often overlooked. Make sure you have friends, family, or a dedicated care team around you to support you through your journey. Their encouragement, assistance with daily tasks, and simply having someone to talk to can significantly impact how quickly and effectively you recover. Social support has been proven to reduce stress hormones and increase healing factors in the body, making an essential component of every comprehensive recovery plan. And finally, number 10, a good attitude. Mindset matters more than most people realize. Recovery isn't always smooth, but having a positive attitude and staying focused on your progress, not just your pain, can make a huge difference in how you heal. Okay, here's a little bonus. Things you absolutely don't need after surgery. A new puppy, flip-flops, rugs, skip them. Anything that increases the risk for falling or requires sudden movement can jeopardize your healing. Stick to the essentials. A final word. Recovery starts with thoughtful preparation and planning. The right tools and resources create a significantly safer, more comfortable, and less stressful healing process for patients. Throughout my experience working with recovery patients, I've seen firsthand seemingly small changes to the recovery environment can make substantial differences in both physical and emotional well-being. When patients have proper preparation, they often report reduced anxiety and achieve better outcomes. For more recovery tips, concierge insights, and modern orthopedic breakthroughs, subscribe now or book your consultation with my team.